Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So this is one more of a kind of an inquiry of, so a high stress person in a concussion producing rapid deceleration, an accident, will have more intense symptoms due to underlying stress. This is what they're asking.
Yeah, so think about it this way. Concussion or persistent concussion symptoms is a direct reflection of your health prior to the injury. So if you already had neck dysfunction from previous car accidents or whatever, then your neck is going to be a problem. You get a concussion, it's more likely that that neck thing exacerbates and you have persistent symptoms due to that neck dysfunction. If you already had chronic inflammation, gut issues, hormone issues, etc., poor sleep, high stress, whatever, you get a concussion, all of that's going to be exacerbated, right? So all of these systems just get exacerbated when a concussion occurs. If you are very healthy, you have really good, strong, neck, you have, good gut health, your inflammation is low, your sleep is good, the chances of you having persistent symptom is much lower. So if we look at young athletes, their risk of PCS is much lower than if we look at middle-aged people because they're more active, they're more healthy, they have less time for that baggage to accumulate, throughout their life. But as you age and things happen and you have life stress and financial stress and kids and whatever else, all of those things are adding up on your system. And now when you get an injury, you're less likely to tolerate that additional stressor that has happened. So if you're already in a stressful state and you get a concussion, that's just going to exacerbate, right? Like the number one predictor of persistent concussion symptoms is your pre-injury mental health status. So if you have pre-existing anxiety, pre-existing depression, your chances of having persistent symptoms is massively increased over somebody who doesn't. It's because it's going to affect those things. Even if you don't have a history of mental health, after concussion within 3 years, the risk of mental health diagnosis, anxiety, depression, PTSD goes up by 2 to 3x. So even without that. So if you already had that and then you get a concussion, your chances of having persistent symptoms increases because of that underlying mental health that is going to get even worse with concussion injury. So really it matters how you came into the injury, and it generally will reflect what's driving your persistent symptoms, right? So if you already had mental health issues, getting a concussion is going to exacerbate that, and it's likely going to be one of the drivers that's preventing recovery. So that's why we address each of those components. I don't know if you guys want to add anything to that.
Yeah. I think I did a live on the predisposing factors. I'm trying to remember what it was called, but we did talk about that in one of my presentations, just around understanding and assessing your predisposing factors to developing persistent symptoms.
And
Nikki,
Melinda,
have that in your master spreadsheet.
yeah, I'm going to look for it. The other thing is, because there's a comment that kind of relates back to it as well on top, just below it, of how it can, for this person, it also triggered some childhood trauma, past abusive relationships, things like that. Could you maybe touch upon that a little bit too?
Yeah, so that's part of the predisposing factors. It's just, understanding what your trauma history looks like, for lack of a better word, is just assessing, what had happened to you leading up to that point, right? Just as the way Dr. Cam had said, what are those stressors? What is your picture like? Are you already someone who's been living with anxiety, depression? Has there been trauma in your past? If so, right, these are things that are out of your control oftentimes, but if that's part of your picture, your clinical picture, then it's likely you may experience more or heightened anxiety, depression following concussion, and you're more predisposed to developing persistent concussion symptoms. Right? So this is kind of part of our program as well, as recognizing that When it comes to developing persistent concussion symptoms, it's likely a result of pre-existing conditions or pre-existing challenges that you faced prior to your concussion. Not just from a mental health perspective, but just as Dr. Kim and I'm sure Dr. Paul has said as well, if you have pre-existing gut issues or hormone challenges, or if you had MSK issues in the past, it's likely any of these things can get flared up following a concussion. Those who recover from concussion and don't go on to develop persistent concussion symptoms are those who were less likely to have some of those predisposing factors. So I would start with reviewing that live we did. Nikki will hunt for us what the name of the live was and go from there. And just like a self-assessment, right? Checking in, hey, was this part of my life before concussion? As a way to sort of make sense of what's happened to you since concussion. Now, if you did have a predisposing factor around, anxiety or depression, for example, that doesn't mean you can't recover. It just
I was
means
just going to say
that
that.
yeah, it doesn't mean you can't recover. It just means that you can identify that as a trigger and then start with the recovery mindset module to start developing skills to respond to how you're feeling now and what has manifested since your concussion. What it really does point to is perhaps before your concussion, you did not have the skills in place to recover from some of those stressors. A lot of people don't. Sometimes it's only when we do have an experience like a concussion that we then learn it's essential to develop those skills to respond to stressors differently or to support anxiety or to support depression. Sometimes it's not brought to our awareness until we experience something more significant like a concussion.
Do you think it was the decoupling maladaptive pathways, how to use neuroplasticity to support your recovery? I don't
It's
remember.
relevant as well. It's not the one I'm thinking of, but I can do some digging as well and see if we
Yeah.
can find the name of it.
Right.
There's one more here that'd be, I think, pretty quick. I've thought about the wreck and what I could have done differently if I could have braced. What does that look like? I mean, you don't want to go too far down that rabbit hole to say like if I had only done this and create the, self-blame and oh, if only this and only that. You're in this situation now, so I would try not to dwell on that too much. But I think that yeah, if you did see it coming and were able to brace, and you would reduce the chances of concussion injury happening potentially, because let's say you brace and you push your head against a headrest, it doesn't matter because when you get hit at enough force, the brain is sitting at a standstill inside the brain. Let's say you're rear-ended, and you look in your rear view and you see something coming, and you brace and you jam your head into the headrest so that you're nice and solid, and your brain is sitting still right now, and all of a sudden boom, it gets hit and your car accelerates at 60 G's forward. Guess what? The brain is moving backwards. So in some cases possibly, in other cases it wouldn't really matter depending on how much force was sustained. Now, if it was more like a light hit, but there was a lot of whipping action because you weren't braced, well, maybe bracing would have potentially helped, but it also could have caused increased neck strain and other things. And so it's really hard to play that game. So
Can you elaborate a little bit as to then why drunk drivers typically are the ones who walk away with less harm versus those who they hit?
yeah, I mean, there's theories on that. One is that they're loose and flailing around and they don't have that same kind of rigidity, which may cause increased injuries in some cases. There's also, theories around like dehydration and other factors that may, play a role.
I mean,
Not
I think
really.
that actually a true fact though? I think we kind of it's like it's the unfortunate, situation that we hear that a drunk driver unfortunately hurt somebody and they are, less worse off than the actual injured person. But I've seen alcohol being a huge amplifier of PCS in my practice. So I'm
Mhm.
not sure even about that data. I think it's just like these are based on anecdotes that we kind of probably
Yeah.
pull together.
Yeah, and maybe it's that emotional component because if a drunk driver causes a fatal accident, but they're fine,
Exactly.
people it gets reported in the news, and then maybe we assume it happens more than it does. I don't know. I don't know what the actual data is on it, um, so I don't know if that's actually a fact or not. But yeah, I've heard that idea expressed before.
And also I guess the one just practical aspect is that they're often most people that are drunk driving, I would assume they're not like, blackout drunk. They're like they still have some coherence, and they're the ones doing the hitting instead of getting hit. So usually it's somebody that's not expecting getting hit. So it kind of goes back full stories. Like they lose control and they hit somebody from behind, and that person is not expecting it, gets the whiplash, and the whole bracing conversation, I think that makes a little bit more physiological sense comes in. That's probably most likely what's happened, where they're not the ones being surprised, so to speak.
A research paper for someone in school. PhD.
Yeah.
Great questions. Thanks so much, guys.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.